So now what is sickle cell anemia? It's an inherited disease which affects the red blood cell. What do I mean? It means that it can be transmitted just via the parents. It's not contagious like people think. I mean, it is not like it's just a mother that transmits. It means it's a father and the mother, they come together and they give birth to a child who is a sickle cell carrier. And that's because the parents did not do their test before, and it affects the red blood cell, giving it a form of a crescent shape, sickle cell shape, in the form of a C, if I should say like that. Because
maybe a sickle?
Yeah. So because normally our red blood cells are normally oval and it is soft. It can circulate normally on the arteries, normally. But when somebody is a sickler, the red blood cells are sickle, and at the end, it is rigid. So at one point, you see it's going to flow, but then it's going to get blocked, and that's why they'll present all the different symptoms that you know.
When we came up with this topic to you, and you, it was as if you've met.
Yes, the response was immediate.
You've met your match. Why?
That's a very good question. I really love the question. What can I say? My passion for sickle cell anemia started when I was it's true it started much earlier, but it really started when I was in year 4 medicine. Okay. When I was doing my internship in the service, I had to see them going through a lot of pains, and I had a classmate who was having her junior brother there, who was hospitalized because of pain crisis. And when I saw the father in tears, it actually touched me. It really pained me. And not just them, I saw a lot of people, they were constantly crying.
You're seeing a man whom you know is the definition of strong, and he has to be crying.
I'm telling you, just imagine. You can imagine how men don't cry easily. Yes. At times, I even used to wish to see their tears, but not in this condition of sickle cell.
Yeah, not like that. So, what a wish you got there.
So, you can just imagine, it was really, really not easy, and it really brought that passion in me to try to see in what way can I be contributive in this domain. And that's why when I defended my thesis in year 7, I had no choice. My mind was focused on sickle cell anemia. Okay. And my thesis was about factors that can influence the quality of life of parents that manage sickle cell disease patients.
Oh, those parents.
Can you imagine, compared to parents that manage HIV patients? Yeah, I compared the two because you realize that HIV, they're fully handled. They don't spend for drugs. They don't spend anything. For lab exams even, it is free of charge. So, but when you look at the stress and the burden that parents of sickle cell disease patients can go through, is quite unbearable. So that's where the passion arises from. And also because, I don't know if I should share this one, but I would say maybe it was just God's grace, because I came up from parents, both of them were AS.
You don't say.
Yeah, but me precisely by God's grace, I'll mention it, I came out AA. But the fact that I came out this way doesn't mean that I want to encourage others. That's why it's a burden to me.
So my manipulation on letters from the start was nothing. You manipulated those letters and picked the A
God
here, picked the other A.
God helps you. Wow.
Yeah, it was really God's grace, because me and my brother, we came out normal. AA, not even carriers of the thread.
Oh, this is so beautiful. God is working in your life in more ways than we can tell. That is great. When you are in the crisis, what could be done firsthand? Let's say first aid that is necessary for a patient who is in crisis, the pain crisis. What could be done?
Okay, the first thing when you're in pain crisis for a patient, first of all, you must be able to identify the intensity. Okay. We must know, you must be able to identify it, because there are some pain crises that can be handled at home. We often call it vaso-occlusive crisis, that's how they know it. They can be handled vaso-occlusive.
Oh, God.
Well, I trust you have already forgotten that now.
So it's just similar. I would just say it's a synonym of pain crisis.
Okay.
Yeah.
It's a synonym of a lighter pain crisis.
Not the intense
not the intense one.
Yeah, so when somebody presents those pain crises, it's important you identify, because normally it can be handled at home. But the reason why they get to the hospital is because they don't do proper management. And that's why one of the things we tell them, when you first of all feel pain, you start from paracetamol, you first of all take it. Once you've taken paracetamol, if it's persisting, then now you can associate anti-inflammatory drugs, but that's after 1 hour, because some of them, they just mix everything together and take. at the
And
end
maybe
of the
because
day,
of the pain, they just want to get rid of it as fast as possible.
that's true, but that's not the right method.
It's not healthy,
because at the end of the day, you won't know exactly what treated the pains. Because when you go stage by stage, you can know at this point in time that probably is
After I
anti-inflammatory.
took this, I felt this way. But when you take 10 things...
it's true, because sometimes even with normal headache, when you take something like paracetamol and then you don't feel fine, you feel like you want to go and take Eferigan. Maybe the Eferigan will do better. You just keep mixing things, and then you become your self-doctor.
Yeah,
exactly.
You do your prescription and take the drug.
And maybe when you do it one time, it works. You feel like, okay, this is the way to go. You keep doing it. Meanwhile, that's not the right way.
But maybe that's not actually...
Yeah, so that's actually it. So we tell them to start from that. They start from paracetamol, then they can take anti-inflammatory drugs. And then after that, if it persists, tramadol enter, but that is with a question mark, because the doctor must prescribe tramadol to you. If the doctor does not prescribe it to you, you cannot just go and have it in the hospital. So you just need to use the ordinance, say that the doctor already prescribed to you. But now if it persists, then now you must find yourself in the hospital. I mean, despite all that. And then there are other general measures that we counsel them to do during that season. They must keep themselves away from cold. They must remain warm. I mean, if you are in an area like here that is cold, you need to always have your pullover.
Okay.
They must drink a lot of water. You know, as we said, their red blood cells are rigid.
Yes.
So what permits it to flow is hydration.
Okay.
So that's why we counsel them to drink at least 3 liters of water per day. Such that when they're in pain crisis, it's going to reduce the pain. So while they're taking the drugs, they have to hydrate them a lot. It's very, very important. They need to rest. Because, you know, pain crisis does not just arise like that. I mean, there are things that actually quench it. I mean, there are things that stimulate the pain crisis, like stress, dehydration. Some of them, they don't want to drink water. You know, it's not so easy. Even us like this, it's not easy to drink water.
Yeah, that's right. At what age, like is there a particular age where one gets to, like a sickle cell warrior gets to, and the pain start manifesting, like the crisis becomes so intense?
It happens at any age. In fact, it does not depend whether you are young or you are old. It happens at any age. So that's why that a lot of measures have, like a lot of things have changed today, because there's one new drug that has come. It's true, it's quite expensive, but it's one of the drugs that avoid them from making crisis frequently or from presenting complications. Yeah.
Well, how much could that be?
Like, let's talk about like 8,000, 9,000. And when it is in rupture, it becomes more costly. Like, I think presently it's actually in rupture. So it's quite expensive. It's hydroxyurea. Like, yeah. Okay. So Hydrea is just like the commercial name for me not to pronounce one scientific name and people be like, hey, this guy have
to save us the stress.
Yeah, to save the stress. So it's something that we encourage them to take, but then it's automatically placed by the doctor. Like the medical doctor has to place you on it, because when you're on
the
it,
tramadol too.
Yeah.
Okay.
So, and because before you start taking that, you need to do some lab exams so that we can evaluate if you're taking it, are the pains are reducing, are they. So at any age, the pains can be very, very intense. So it depends now on each person how you follow the measures that you're supposed to do, like in the house. Like if you don't drink a lot of water, at some point it's true that some adults that they don't overface pains again like before, because I've gotten used to the fact that they need to drink a lot of water. They need to keep themselves warm. They need to avoid, I mean, feeling too much heat too can also cause dehydration.
Okay, so too much cold, too much heat.
Yeah,
you should not
excess of a lot of things is bad. Okay. So that's actually it. We don't talk about emotions here. It's not about emotions. It's not about how you feel. That's what I always say. And whenever they will ask me, I'll always say it's not about emotions. Yeah. Why? Because it's true I came from a home where both parents were AS, but they did not know. They were ignorant. So you can imagine. So once they discovered, they stopped giving birth.
Like, that's fear of having it.
Yes. So we are just 2 of us. So they just stopped because they knew that.
So you got all the pampering you needed because you're just 2. And
hey. So that's why at the end of the day, I encourage people to know their status. Because, you know, we're even talking like that, maybe people don't know what is compatible and not compatible.
Yeah.
You need to be for you to know your status. First of all, there are 4. It's true that sickle cell disease is a whole syndrome, so there are many. But what is frequent in our context is sickle cell anemia. and sickle cell anemia means you are SS. How does it happen? If your father is AS and your mom is AS, you have 50% of chances of having a child who is AS. Who is actually AS, yes. 25% of chances of having a child who is SS and 25% of chances of having a child who is AA. So now what does the problem come in? Is that many parents think that, okay, because I gave birth the first time, the child is actually AS. So it means that the second time, the child will be AS again. The third time, the child will be AA. The fourth time, the child will be SS. But the thing is, please, if you're listening to me, it changes. Probability does not, it's not like...
It doesn't work on probability.
Yeah. It is renewed whenever you give birth. So you can give birth to your first child is SS. You give birth again, second child, SS. Third child again, SS. Because people think that because the first time is SS, it can never be.
Okay, they won't have another
they join the partner and going on, and then they think, okay,
which kind of technicality is that? So why would they think that?
So that's what many people think, and they keep trying now. Like, if I try, God is going to help me. Even God is a God that is organized, for God's sake. So, like, I mean, at this point in time, the choice is left to you. So if you're actually AS, make sure that before engaging with your partner, we're not even talking about engagement, before even thinking of saying I love you, first of all, know the status of the person. Because at times people think that the only time you're supposed to know your electrophoresis, it means that...
When you're about getting married.
Yeah. So that
they just said the other time that instead of asking what you do for a living, ask what your blood group is.
Exactly. So yeah, that's exactly what they're supposed to do. So once, in fact, before you cannot be thinking of getting a relationship. I'm not even talking about marriage or fiancé, but just get to just boyfriend and girlfriend dating. And you do aside from that, if you are AS, you shouldn't.
You have chances.
Like, I was feeling a fire, and then I saw whether it's a husband or the wife was AS, and then the partner was SS. I'm like, how do you guys do that?
And do they know? Are they
and
aware?
the child, they know, because the child at the end of the day is actually SS. I mean, like, how on earth can you be SS and you still go, you're enduring the pain? And you go and put yourself.
The wife already has been living like that from birth. She's SS. Yeah.
So now you go and match yourself again with somebody who is AS, like, to produce what? I mean, to, like, a child who is going to be suffering. You suffered.
Yes.
You cannot, like, indulge that kind of pain.
And you
like,
want another person to go through that same pain.
Like, and that's what happens in the society today, and it's really, really sad. So it's not
making
because
choices out of emotions and not logic.
Exactly. This is not about emotions. I mean, we should be realistic, because we should, like, I think there was a post I put on LinkedIn. I was like, emotions versus reality, because I think we have to be realistic here. It's not about how you feel. It's not about the love, because you can love anyone at any point in time. But look at the future. Are you sure you are ready to live your life every night? Somebody is crying around you and feeling pains. No, you're not. So, I mean, wherever you are, know your state you. Go to the hospital. There was even a campaign that was on in Lakentini Hospital recently, free screening of sickle cell. I'm telling you, but it
take advantage of campaigns.
Yes,
if you say it's too expensive.
I'm telling you, but now like this, really take advantage. It's expensive, but it's better than the pains that you can go through in future. So we encourage you to know your status, and for you couples that are actually incompatible, we are not telling you not to get married, but we are telling you to make the right choice. If you always have a first child who is normal, second child normal, please don't think
thank God and stop.
Yeah, thank God and just stop, like Miss Bibiane just said.
I've learned a lot today. I'm happy because we cannot overemphasize about the sickle cell anemia. We cannot overemphasize. We always talk about it. Even tomorrow we can still talk about it. Just wake up and you talk about it. Awareness is important.